Hi, I'm Kerry Rogers. I'm an associate professor in the Division of Hematology at The Ohio State University in Columbus, Ohio, and I'm really excited to be at the European Hematology Association meeting. It's my privilege at this meeting to present follow-up data from a phase 2 study we did. So that's a smaller study trying to learn something new about how we might treat CLL. So we did a study where we took 28 people with CLL who were taking Ibrutinib, which is the kind of first-in-class BTK inhibitor. So it's a similar drug to acalabrutinib and zanubrutinib that are more commonly used now. And these were people who were taking the drug and had a change in their CLL where it had developed a mutation that predicts that the drug is going to stop working. So some of the patients in the study had signs that the drug ibrutinib wasn't working to control their CLL anymore, and some of them did not, but had this marker or mutation that their CLL developed that would mean that it would ultimately outsmart the drug. And we added a second drug, Venetoclax, which is another targeted drug with a different mechanism, and then tried to see if we could improve how long they stayed in remission, and if they got a deep enough response that they could actually stop treatment and spend time in remission not taking treatment. So just for context, usually people who are taking ibrutinib or other BTK inhibitors like ibrutinib, at the time that their CLL progresses on it, will take another drug and kind of expect to remain on treatments. So we're trying to see if we can get a deep enough remission that they could have time off treatment. So this is follow-up results of the study. The study has been going on for many years, and so we've learned that actually the median, which you can think of like an average amount of time before the CLL progressed after we added Venetoclax to ibrutinib, was about 40 months. Just for context, if you switch to Venetoclax instead of adding it, it's only about 24 months or 2 years. So we increased the amount of time people stayed in remission by adding Venetoclax rather than switching to it as a treatment.
How much space?
So we thought that was really exciting just to see that kind of improvement in how well the CLL was controlled. And about half of the patients were able to stop treatment due to achieving a deep enough remission, and then spend time off treatment and just enjoying their lives, not taking medications, or not taking medications for CLL at least. It was a little variable when people achieved that response, so it wasn't all at the same time that they stopped treatment. But it was really exciting to see that some were able to be off treatment. And kind of it's actually a median, but you can think of it like an average amount of time people who stopped treatment were able to be off treatment before their CLL returned was close to 2 years. So we thought this was really exciting because it showed in this smaller study that the strategy of adding a BCL2 inhibitor, Venetoclax, to the BTK inhibitor, Ibrutinib, at a time when it wasn't working could really improve outcomes or how long people stay in remission, allow people to stop treatment, and really just had a lot of benefits with that approach rather than just switching to Venetoclax. We're now conducting kind of a newer iteration of this type of study where we're taking patients who are taking any BTK inhibitor, so ibrutinib, zanubrutinib, or acalabrutinib, and at the time their CLL progresses or returns while they're taking that drug, switching to a BTK inhibitor that works in resistance, pirtobrutinib, with Venetoclax for like a finite treatment. So it's just really exciting to present these kind of follow-up results for the people in the study, showing that this approach to treating CLL really can work.